All right, here we go. Hello, I am Keith Heinley. I am the Vice President of Community Impact here at United Way of Brevard. I have quite a few responsibilities. Fortunately, I have a team to help meet those responsibilities. Um, I am the one who I don't go out and raise the money. Well, in some cases I do, but for the most part, I don't go out and raise the money for the United Way programs, but I am the one who's responsible for setting up the system for dispersing that money uh, for our different agencies in Brevard County. I have the fun part. I don't raise the money, I get to spend it. So besides that, I also have a number of other programs uh, that are involved with United Way that include education programs, income programs such as the health insurance, the income program such as the volunteer income tax assistance program. We have other health programs. We have the Mayor's Fitness Challenge that's currently going on. We have Run United, where we manage or help support uh, morning fitness programs in each of the schools. We also have something called Mission United that helps support military families, veterans, and their families as well with various needs. Usually, we try to focus on helping those individuals who cannot get assistance elsewhere. So we're kind of the ones that come in and help with those unmet needs. And we do volunteer programs as well. That's enough about those things. Right now, I want to talk about the health insurance marketplace. We have been involved with the health insurance marketplace since 2013 when the Affordable Care Act was first signed. It had a rocky start, but we jumped on board with the Florida consortium of partners. I'm going to go to my next page. We belong to a group of people called the Florida Covering Kids and Families, and we are one of their consortium partners in the state of Florida, so that we have partners throughout the entire state of Florida who can help people sign up for health insurance on the marketplace. And you can see on the list, we are the only United Way on that list. And whereas most of these partners cover, uh, you know, more than one county, sometimes up to, multiple counties, 5 or 6 counties, um, we cover one county. We cover Brevard County. It's a, as you know, pretty big county. So we are the only one for that. Plus, and that's why we're able to be involved, because United Way is focused only on its own county. Each United Way is focused on its own territory. And our territory is Brevard County, so we don't like to um, to reach beyond our borders. But in terms of helping people sign up for health insurance on the marketplace, anybody from anywhere else can come to one of our locations, and doesn't matter where we live, where they live, we can still help them sign up for coverage. So the health insurance coverage, why is this important? All Affordable Care Act marketplace plans do cover doctor office visits, hospital stays, prescriptions, preventive care, and more. And all the plans cover pre-existing conditions. Um, I know most of you already know that, but I think it's a big plus for the Affordable Care Act that at that point that was signed. If you remember, insurance companies at one time could deny you if you had a pre-existing condition. Thankfully, that is no more. And I personally am thankful, because I have conditions that if I lost insurance, I would not want to be in a situation where I couldn't get coverage. Our navigators can help find plans that keep you covered no matter what life throws at you. We never charge a fee for services to Florida healthcare health coverage consumers. That's one of the agreements that we have with the federal marketplace. We don't charge anything for services. We've had navigators at sites where people actually tried to push money across the table at them after they helped them. And my navigators are trained, if that happens, they just push the money right back. They don't accept any of that, that kind of assistance. I mean, any type of fees. So it is a free service to the community, and definitely something that we will continue to keep that way. An accident, illness, or injury can happen at any time. When it does, last thing you should have to worry about is how to pay for your health care or taking on medical debt. As a social worker, I was a case manager and social worker for many years before I ended up in this position at United Way. And I have dealt with many families over the years who struggled with healthcare issues, and primarily with medical debt that they weren't able to pay without some type of assistance. So on the marketplace, 4 out of 5 can find a plan for $10 or less. What I need to share about that is those individuals are individuals who are at the between Medicaid and 250% of federal poverty level. Those individuals and their families who fit within that income range are able to get not only the tax credits that are on the marketplace, but they get what they call cost sharing reductions that help reduce the amounts of the premiums, help reduce the co-pays and out of pocket maximum. All those other items are reduced, based on that extra subsidy assistance up to 250% of federal poverty level. Now, from 250% to 400% of federal poverty level, they still get the tax credits. They just don't get the cost sharing reductions. And unfortunately, the state of Florida continues to choose, one of only 12 states now that continue to choose not to accept the expanded Medicaid. So that means anyone that is at under 100% federal poverty level is just like somebody that's over 400% federal poverty level. They would have to pay the full price of the premium, which means that the poorest of our community are the individuals who are also unable to get insured because of the cost. So for year-round, and going back to a question in the chat before I go on to the next part, are there any fitness programs with the marketplace plans? Yes, many of them have do fitness plans. In fact, when you look through the marketplace plans, you'll see they put that in the title. So they'll say, the Health First fitness plan, or the Joe, I'm sure that if I remember, I do know Florida Healthcare Plans has fitness plans as well, because our own United Way now has a Florida Healthcare plan, and it includes a fitness plan. So year-round services, open enrollment was November through January 15th. We have certain numbers that we try to reach throughout the year, and we made a good push towards hitting those numbers during open enrollment. And one way we did that was called with Nav Labs. We had certain locations that were called Navigator Labs, where we had numerous navigators together and advertised that out as best we could, had people come to those locations. Probably our most active location was on the last day of open enrollment, which would make sense. That was at Eau Gallie Library, and had quite a few people at that location. So open enrollment was November 1st through January 15th, but year round, we still provide what we call special enrollment. That continues in order to assist eligible consumers who may have lost or reduced income, change in residence, and other significant life-changing circumstances that I'm going to address in just a few minutes. If you need the help of a navigator, I put that number in the slide. It's 321-615-3764. That's a designated line right here at United Way. We have people that take those messages off that phone, and then we put those, we provide those messages to our navigators, and then the navigators will set up the schedule for appointments. Our navigators, a little bit about them. Covering Florida, navigators deliver free outreach and enrollment services to any Floridian that needs to enroll in healthcare coverage in the marketplace. We assist consumers with telephone, in-person, and virtual online enrollment service, and provide public education and outreach activities at locations throughout the county. A little bit more about that. I have 2 full-time navigators that just specifically help with enrollment alone, and I'll get to who they are and their locations shortly. I have 1 part-time navigator that just does enrollment as well, and she is one of them that has been with us since 2013, and whereas I have been running the overall program, and now also with the assistance of Morgan, who helps me run the program now. Millie Correa is the one that's been with us from the beginning, but she's been doing enrollments from the beginning. So I would call her the expert as far as enrollments go, and as far as understanding about all the different plans. And then for the education and outreach, Morgan Bonilla, who is helping me run the marketplace for the next 3 years, she has taken on part of the responsibility of the outreach as well as enrollment. And I am not doing very many enrollments because I'm focusing mostly on providing educational services like this Zoom call right now, and also doing outreach activities as well. So that's, that's where my real focus is. Our navigators are trained, certified, and licensed by the state to help consumers as they shop for health coverage options through the marketplace, including completing eligibility and enrollment forms. A little bit more about that. We are required by the grant to help individuals with their marketplace applications and assisting with helping them gain coverage. The only thing a navigator can't do for the consumers is choose their plan for them. We can't direct them to a specific plan, but we can share all of our knowledge about the different plans. But it's up to the consumer themselves to choose which plan that they actually want. And then we don't limit it because our focus as marketplace navigators is even though we want to make sure we're able to help people enroll into the marketplace, our primary goal, our primary interest here in Brevard County is just making sure we're able to help people with their questions, with their coverage, whether it's on the marketplace or not. So if someone comes in and they want to apply for Medicaid, we will help them apply for Medicaid. We may do that on the marketplace, or we may just go to the DCF site. If they come to us asking for help with Florida Kid Care, we'll help them with that application as well. They're all our navigators are trained with those things as well. And then this year, a little somewhat surprising because we hadn't had this to deal with in the past, but this year we have had a large amount of individuals come to our locations for help with Medicare. Now, Medicare applications definitely are not within the scope of what we do as a marketplace. But like I said, we're here to help out the consumer. So, and I recently just started receiving Medicare myself, so I've been through that system. So I did train my navigators, or have my navigators trained by someone with Social Security on how to do the Medicare applications as well. And so we're able to assist them. It just doesn't really count towards our numbers, but certainly we want to help out as many people as we can with their coverage. Covering Florida navigators, like I said, are free to consumers and provide confidential one-on-one customer assistance. What I want to say about that is that we choose locations that are ADA compliant and provide as much privacy as possible. So during the enrollment period, that was at the various public libraries throughout the county. It was also at Career Source Brevard locations and local hospital locations. So all areas that were definitely ADA compliant and accessible to our consumers, but also enabled us to provide that one-on-one assistance. Now, the difference between what we have been doing for the enrollment period and then what we're doing now for the special enrollment period in terms of location is basically, before we were located in places where people would come to us. Now because it's the special enrollment period, our navigators are in locations where we're actually going to where people are already going to. So we're going to the people rather than having them come to us. And I'll get to that in a minute. Okay, navigators, what they do, an individual organization that's trained and able to help consumers self-employed as they look for health coverage options through the marketplace, including completing eligibility and enrollment forms. I wanted to keep this, even though it's a restatement of what I said before, I wanted to keep this up here basically because, a lot of people don't realize that even though we don't do businesses on the marketplace, that would be for people like Raymond and Joseph that are on the call, as examples to take care of. But even though we don't do businesses for the navigators on the marketplace, we do help out individuals who are self-employed because they would count under, the people that we can help through the federal marketplace. Our navigators are required to be unbiased. Like I said, they can't choose a plan for a consumer. They can't even say, this is my plan that I work with and it works for me. We can't say things like that. We cannot direct them in any way to a particular plan. We can just simply, if they're looking at plans and they want to compare plans on the marketplace, we can talk about, well, this is what this one covers. This is what this one covers. You're a diabetic. This particular plan has a program for diabetes. You have heart issues. This program has specific programs for individuals with heart conditions. You want to find a plan that has your heart doctor on there. Well, let's search for a plan that has this particular doctor. Or if you have particular medications, let's search for a plan that has those medications that you require. So all of that is possible for a navigator to help with. Our United Way of Brevard navigators are Alina Esquivel. She covers most of the North Brevard area and the Cocoa Beach and Cape Canaveral communities. Millie Correa is covering our Central Brevard area. Carlene covers South Brevard, mostly Melbourne. Morgan is we have some Palm Bay locations and she does that, as well as outreach. Morgan also runs our volunteer income tax assistance program. And as you know, everything in the marketplace is connected to your taxes as well. So, normally we have navigators at the different VITA sites, the volunteer income tax assistance sites. And we do also there, but this year we have a VITA person at every site since Morgan, a navigator at every site since Morgan is also a navigator for the ACA and runs the VITA sites. So we're able to assist people with their ACA questions while they're turning in their tax forms. And then myself focusing on education and outreach. Again, I want to share, if you want to schedule or have someone referred to see a navigator, have them call 321-615-3764. Okay, so now on to the special enrollment period. You can buy a health plan if you qualify for a special enrollment period after January 15th and up until the next enrollment period. So different, I have the link, but I decided not to click on the link. I just put the information here on this page, sharing how a person can get insurance during the special enrollment period. So if they have certain life events like losing health coverage or moving from one zip code to another, they get married, they have a baby or adopt a child, maybe they got divorced or legally separated and lost health insurance. Getting divorced or legally separated by itself doesn't qualify them, but if they got divorced, legally separated, and lost their health insurance, then certainly then they would qualify to be able to enroll. Loss of a family member may qualify you to, make all of these things may qualify you to enroll in or change marketplace health plans outside of the open enrollment period. So there's lots of opportunity, a lot of different things. If you're not sure. Oh, yeah, lost credible coverage would be one too. If you find out that your coverage is not affordable by marketplace standards, then certainly you can sign up under the marketplace as well. The best way, if you're not sure if you're going to qualify or not, go see a navigator. Let them help you with the marketplace application, and let the application determine whether it's going to work out for you or not. It's certainly worth the effort to do that. We can help with Medicaid. People with low income, including individuals, families, and children, pregnant women, older adults, and people with disabilities may qualify. And if eligible, they can apply at any time. And Florida Kid Care. We've been helping with Florida Kid Care also for long before 2013. We've been helping with that for quite a while. The CHIP, the Children's Health Insurance Program in Florida, is called Florida Kid Care, helps children in households that earn too much money to qualify for Medicaid, but not enough to buy private insurance. In some states, CHIP covers pregnant women as well. I believe in Florida, we cover pregnant women. The only period of time that CHIP doesn't cover someone, and it's basically a problem with their own legislative law, and it happened back when it was first submitted. Someone missed it and it wasn't never fixed, is that first year after a child is born. So kind of tough, but they can still get coverage through family, through the marketplace, or through the other Medicaid or those kind of things, but just if it's only under Florida Kid Care, then there's a gap in those service for just that year. Will you save money on the marketplace? Your savings depends on your household income for 2022. To get an idea of if you'll save, I'm going to click on this link. And let me get to where I need to go. And then I'll share this page as well. Here it is. Okay. They changed the wording since it went into the special enrollment period. I'm looking for the see help now. I'll put it over here. Stop share. Okay, do you see what state do you live in and all that stuff?
Yeah, I can see it, Keith.
All right. Sorry about my delay here. They changed this on here. I'm looking for the no, I don't. Yeah, finally found it. Okay. 329. I'm just going to put any zip code in here. All right. Skip that part. Is it more than one person? Let's do, yes, let's do two people. Yes, be filing a claim, one dependent. Age, let's say 35, female. I'm gonna say, I'm not gonna click on any of these, but I do want to share with you, if you click on tobacco user, and certainly don't want to lie about it because that would be fraud, but if you click on tobacco user, you'll still get the tax credits, but the amount of your premium would be about 50% more than it would be for somebody that is not a tobacco user. Let's say 34, male, none of these, independent one, 12, male, none of these. Okay, confirm. Now this I'm going to put different price ranges on here. I'll put a pretty high one. I'll put let's say 75,000. And they get a tax credit of $663 per month. And then you can view plans, and their lowest premium is $167.95. So they still get a tax credit because it's 3 people in the household. So I want to go back, and let's say 35,000. And this pops up because at 35,000, the child would likely be eligible to get Medicaid or CHIP. and their tax credit is $837 a month. And then by choosing viewing plans at this amount of money, which is probably more realistic than the first one that I did, this pops up. That means the silver plans. If you choose silver plans, that's the ones under this income range where they would get cost sharing reductions. So if let's click on silver plans, first one comes up, the cheapest one at the 35,000 a year for this family is only $866 a month premium, and it's a Health First commercial plan with a $1,600 deductible, which is not that bad either, and the copays are not that bad. And then next one is Ambetter, and then on up there, Oscar, and other plans as you go up. So as you can see, many of these plans, if they are under 250% federal poverty level, is definitely affordable for people. And that messaging is not out there as much as I would like to see it. But let's say, I'm going to do one more here. One or two more, 18,000. And yeah, that was probably the right way to go. And it says the child will still probably be covered by Medicaid and CHIP, but since they're under 100% federal poverty level, this couple would not be able to get insurance under the marketplace. And they would have to, unless they paid the full plan price, and the lowest full plan price would be $379.76 for someone who is only making $35,000 a year for their entire family. So any other ones you want me to try, or yeah, I think you got a good idea of what this is all about. Are we back on my first screen?
Yes, I see it.
Good. So by doing that, by showing you, and it shouldn't have been so hard to find that tool, because it should be available to everybody. So maybe on healthcare.gov, there is another place where you can find it. It's a little easier. But that tool is really good to use on the marketplace, because then before you even go in to look and see if you want to apply for a particular plan, you can use that tool to actually look at the plans and see if it's going to be affordable for you or not. What else can navigators do? Like I said, they can help with Medicaid and Florida Kid Care. We've been answering questions about Medicare, but our navigators have attended trainings on all the different plans with all the different insurance companies that are on the marketplace, even the insurance companies that are not on the marketplace in Brevard. They attended the trainings for the other plans throughout the state. So they're very knowledgeable about all the specific plans, the details of the plans, the hospitals that are connected to each of the different plans, even the urgent care facilities that are connected to the plans. They know quite a bit about all of the different services that are out there. So our navigator locations right now, like I said, during the special enrollment period, instead of just being at libraries and hospitals, we've spread out. We have kept some of our libraries because they're in communities where we think we can really affect the people who most need it during the special enrollment period. So we have the Titusville Library. We're in Career Source Titusville, Parish Medical Center, Harry T. Moore Center in Titusville, North Brevard Charities, and the Cocoa Beach Library. So In the North Brevard and beach communities, we're in all of those locations. In Central Brevard, we're at the Cocoa Library, Career Source Rockledge, the Central Brevard Sharing Center, and the Viera Regional Community Center. We're at the Viera Regional Community Center because that's where one of our tax sites is. And then South Brevard, we're at the Satellite Beach Library, Melbourne Library, Palm Bay City Hall, also a tax site, and Salvation Army Melbourne, also a tax site. So if you go to the tax sites, even if you don't want to get your taxes done by our VITA volunteers, we have navigators that can help with health insurance applications on the marketplace. How can you get started? Well, you can call us at 321-615-3764. I think I've said that number 3 times now, so I understand if you say it 3 times, it implants it in your memory. So pop quiz, if you'll get yourselves off of mute, you can shout out your answers. What was the open enrollment period?
It ended in January. Was it the 15th or?
Yes, January 15th, ended, started in November 1st, went through January 15th. Florida Covering Kids and Families is located where? I did not share that information. I just showed the slide.
But you did. I think you do have till January 30th to make any corrections. Just to add on to that with the enrollment period, they did extend it to January 15th. Normally it just ends in December, but because of the new administration that we have, that we were able to get that extended. So I do think that if anybody had any adjustments, like their plan wouldn't go through or something like that, that they had till January.
Oh yeah, they 30th. they also allow a little bit of lax time on those kind of things. Yes.
Yeah.
Florida Covering Kids and Families is actually located in Tampa. I used to have to make that trip regularly as the manager of the marketplace grant in Brevard. And I was also a member of the Florida Covering Kids and Families. I don't know what they call themselves, committee. But it's the organization that creates and sets the policies for a lot of these different plans and programs. Used to have some effect on changing, trying to make Medicaid a little bit easier to understand. And now the Medicaid site is probably the easiest of all of them to sign up. So a lot of changes were made in the last few years. How much does Navigator Services cost?
No fee associated with it.
Yes, thank you. Will the plan cover your pre-existing condition?
Yes.
Yes.
All right. Can you enroll after the enrollment period?
Yes, with certain circumstances.
Yeah, and there are a lot of different reasons why. So, what I forgot to mention is with our navigators, because of the changes that we make, we'd usually do just as well during the special enrollment period as we do during the enrollment period. So that's a credit to our navigators. So we have in the past been one of the most productive groups in the state, even against organizations that had 15, 20 navigators. Our navigators would outperform them. So hopefully we can get there again. How can you reach a navigator?
The number you had up.
That's right. That's right. And I will post this video on Facebook. So if you need that number, you can just go on to it, or I can also email this out to you on if you put your emails in the chat.
I'm sorry, one quick question. So you said that there's representation at each of those locations. So the one being in Cocoa Beach Library.
Yep.
You can walk in between 10 and 3 and someone
Yes.
will be there to
Yes, Alina will be
Oh.
there to answer your questions or help you out with getting insurance.
Okay, so that is still current going on.
Yep.
Thank you.
Yeah, all these locations are current right now. So,
Okay. Perfect.
this little statement down here that I have is just a requirement anytime we do any public education or something like that. Our grant requires us to add this little statement from Department of Health and Human Services, CMS. And then how do you find out if you're going to save money without actually applying for the health insurance?
What you did going through the exercise or what?
Yep,
What's
that's it.
required or whatever?
There's a place on healthcare.gov where you can not the find local help number, the link, but the link that says find out if you can save money. Click on that, and then you'll be able to go through that exercise yourself with the real information. So any other questions? Let me stop my share here.
I'm curious what you find as a navigator your most frequently asked questions from the public are.
It's changed from year to year. The first year in 2013, we had a lot of angry people that came to our sites because they were persuaded by political opinion. And then we would just listen to those people, let them air out their concerns. And then we would just politely say, well, even so, let's take a look at the marketplace and see how it looks for you. And more often than not, they end up choosing the plan on the marketplace. So,
Yeah.
and then for a while, we did shop plans, which was fun. We enjoyed doing it for a period of time. We did that. You would know that's the ones with businesses. Before that, switched completely over to agents and brokers. And then, but most recently, I guess, now that the mandate is gone, the people who come and see navigators are less interested in, when the mandate was there, most often than not, they were just trying to look for a plan that was inexpensive. Many of these people felt like they were healthy. So it didn't care them so much about the amount of the deductibles or the out-of-pocket maximum. They just wanted inexpensive plans to meet the mandate. So we had a lot of them. Now that the mandate's gone, the people actually coming to the navigators are more concerned about, okay, I want to make sure I keep my doctor. I want to make sure I keep my particular medications that I have. I want to I've been on this particular plan for with the marketplace for a couple of years, and the insurance company raised the rates on this particular plan. Can I check and see if there's something else that's better? So we got questions like that. But surprisingly, like I said earlier, I'm getting a lot of people that are coming in asking about Medicare. And I think that's because of COVID. There were a lot of people with Shine who were out in the community who helped with those questions. And with COVID, they went to just telephone, but people really wanted to see somebody when they had questions and concerns. So we made ourselves available to them as well.
Also, I want to share. I think it's really important that we all are on the same team here, because there's plenty of business out there for everybody, right?
Right.
Whether you're a navigator or you're a health insurance agent or anything like that. So I'm open to sharing tips and stuff like that. And I find I talk to my clients after they enrolled with me, make sure they're happy, what kind of experience they're having with that carrier. So I think I bring in some valuable knowledge, and I'm not here to get rich. I'm just here to help people, and I get rewarded from, small commissions. And one of the tips that I have is that when you have a married couple, it's always best to, and you correct me if I'm wrong, is put the primary as the younger person in the couple, because once they get older and they reach Medicare, right, age, then the older person will hit Medicare first, and that dissolves the plan. So I always thought it was best, and you can correct me if I'm wrong, is to have the younger person, the younger spouse, as the primary in the marketplace plan, and then have the older person as the dependent. Would you agree with that or
Um,
have any thoughts on that?
in most cases, it wouldn't be so much of an issue because what we recommend to people is every year when it's time to renew their plan, it could be automatically renewed. Or they could come, or they can go back in and take another look. And we really recommend that they always go back into the marketplace because they may find more savings by either choosing a different plan or renewing under the marketplace. Because if they just let it automatically renew, they may not be able to take advantage of.
That's a good point. I've seen some issues that where we were depending on auto renew and it didn't go through.
Right.
For some reason. So we recommended that people re-enroll even in the same plan. So
Right.
unlike Medicare, where they can stick to the same plan and it goes into the next plan, we've noticed some bugs, where people, and I've seen it, where I just told them it'll just auto renew, but in fact it did, but then plan got canceled for some reason. So it's something to watch out for there. So it's good to purposely renew the plan, go through the enrollment process again. It's long, it's laborious, but in the end run, it's worthwhile,
Yeah. And I do appreciate the insurance agents and brokers that are out there that are working and doing it legitimately. I will tell you, according to our grant, we cannot be co-located with you or anything like that. But we do go to the different plans and ask them to provide training for our navigators. It's been very helpful.
Share a dialogue. We can certainly talk with one another, right?
Right.
Yeah.
So yeah, we're very, very open to that.
Yeah, we're on the same team. We want to just see people get covered,
That's the key. That's the key. I will tell you though, there are some insurance agents out there, even here in Brevard County, that are not as above board, and we've had situations, and especially in the early part of the work that we did, where an agent would actually sit outside the door that was being used at one of our libraries to try to steal away the consumers that had appointments with navigators. So that was definitely I don't know if it's
definitely a no.
yeah, I don't know if it
you would see me doing that. Okay?
Yeah,
All right.
I don't know if it was anything illegal, but it was definitely not kosher. So
Another question I have, and I do a lot of Medicare, I'm a veteran, right? So I do a lot of Medicare Advantage plans with veterans, right? They already have VA benefits. Do you see any kind of plans out there for veterans, younger veterans who are under 65 with the marketplace? Would it behoove somebody, if they're already getting Veteran Administration benefits, to also maybe get a get a marketplace plan, in your
I will
opinion?
tell you, if they have TRICARE, there's no need to look at anything on the marketplace. You cannot beat TRICARE. If they have TRICARE. If they don't have TRICARE, certainly, especially if their family members are not covered, definitely want to look at the marketplace plans. But we don't compete with TRICARE. TRICARE is an amazing program.
It is, but also, like I have a Medicare Advantage plan myself, and the reason I do it because the VA clinic is way over in Viera, and I like being able to have my primary care physician down on the corner of A1A and 520.
Yeah, that's
I
a
like
good
to be able
point.
to
Yeah.
walk in there. I have urgent care. Also, I also get silver sneakers, right, which the VA doesn't offer, and I can go to my local club free of charge because I have this Medicare Advantage plan. So, and I just wondered if you would recommend a Medicare Advantage plan to a veteran,
Yeah.
a marketplace plan.
Yeah, two things. One, being a navigator, I'm not comfortable with suggesting or encouraging people for any particular plan. On the other hand, though, I will tell you that I chose a Medicare Advantage plan based on the very same reason that you said, and that is I was able to keep my doctors and my medications under that particular plan, and that's why I chose it.
Keith, I have a question. On the market, healthcare.gov site, does it show which physicians and, healthcare providers that are in like Health First and? in the
Yes,
different-
let me see if I can get to that page and share it with you. Thank you for that question.
Welcome.
And I'll need to make sure, because I have so many pages on my screen, I need to make sure that you can see what I'm sharing. I get this phone call from a guy named Scam Likely all the time, so.
Scam. That's funny.
You see the
Good one.
healthcare.gov site?
Yeah.
Okay, so see if you can enroll, see if you can change, find local help, pay your premium, quick start guide. But you want to see the actual plan, so let me. I don't want to apply for a plan. I want to see if I can save. There it is. See, the link used to be, and where did I just find that a minute ago? Let's try this again. I want to get to the plans and answer those questions for you, but I need to get there somehow. How did I get there before? Here we go. Sorry about that.
Oh, that's it. Yep.
See plans and prices. That's what those are. That's in the search bar. That's what you put, and you'll find it that way. So when you get to these sites where you see the plans,
Mhm.
and you want to find a particular doctor, so just click on add medical providers, and let's say Dr. And what's Dr. Mendola's first name? Oh, gosh. Does anybody else have a doctor that they want to mention? Jamie Van Acker, I know her. Okay, so I want to add Jamie Van Acker to my plans. So So back to plans. And now if I want to find a plan that has Dr. Jamie Van Acker in it, you look through the plans and any of them that have a little green check mark next to that name is a plan that covers that particular doctor.
Okay.
Now, she's under the Health First plan because she's the Health First doctor. And then same with prescription drugs. You can do the same thing if you have a particular drug, let's say, this one's going to be on probably quite a few of them. Let's choose that one. So if you want to see if metformin, that particular metformin's covered, you'll see X's all the way down through here until you find one that has that particular plan. That's pretty specialized, so it's probably not going to be on any of these, but I did that just to show that.
Way
So
to
that-
find it.
Yeah, so
The
you
way to
can
search,
find
okay.
find the drugs that way, or the doctors as well. And then, hey, you think you might like this plan, so let's hit compare. And let's find, I'm getting past the embedder and let's go an extra page and Oscar. Florida healthcare plan, that's what I was looking for. All right. So I have two plans that I chose fairly distance apart. And then you can actually compare the two plans apples to apples. So one next to the other. And then you can see what the differences are for each of the plans. So this plan, Jamie Van Acker is a provider or nurse practitioner, and this one, she's not. Both silver plans, 800 deductible, no deductible on this one, but charge a little bit more on their premium. So. And this is a question about the gym. This one is a gym access plan, so kind of answers your question earlier, Raymond.
So if your plan does include fitness, then you need to look up like which facility is near you. And then
Yeah, you'll have to look at the plan details, and that's when you go over here, and this will tell you more about the highlights and then more details. You click on each of these plan documents, costs for Medicare, access to doctors, on down. Acupuncture, and I don't know that this one has a fitness plan associated with it, but if it did, it would be under one of these
So-
drop downs.
Okay,
Yeah.
so if it did have a fitness associated with it and a facility will cover it, what do you do when you go in? You just tell them it's on your insurance, you show them proof?
Yeah,
then-
yeah, you just show them your insurance card.
Okay, and then you just come and go,
Yep,
whatever they,
yep. Once they've
Sign you
got
up
you
and-
in, then you don't have to show it anymore. So,
yeah, okay, thank you.
I know the Florida healthcare plan that we have here at, I'm not on it because I made it to Medicare, but our Florida healthcare plan has a gym access on it and it's all your more common gyms that are out there. So
Yeah. And I was talking to a client yesterday, which has a marketplace plan through Health First. Hope it's okay to mention it. But I mentioned about the excellent workout facilities there. And he was like getting ready to cancel the plan. He said, "Oh, I don't really need this." But when he heard about that, he said, "Okay, yeah, let's continue with this plan here. I want to go out and work." And they have great workout center, by the way.
Oh, yeah.
Vieira. Sad to say they closed down in Cocoa Beach though. That was one I was using
Yeah.
when I had a plan and stuff like that. But another thing that's really important, I think, is preventive health. You know, you can't overemphasize that.
Right.
That, you know, if you want people to stay healthy, then they should exercise the preventive health element to their marketplace plans, and they'll get the value out of it. Because sometimes people don't see the value into it until they start using it. You know what I'm saying?
And even if they don't go to the gym, they can get out there and stay active. So
Oh, yeah,
sign
for
up for
sure.
the Mayor's Fitness Challenge.
Yeah, and also like my Medicare Advantage plan has silver sneakers, you know, and
Yep.
I did the at home learning to walk thing, strong walk. It was very, very good. You know, it's very excellent. So I'm looking for now for a fitness center that has a Peloton. So, but that's
Yeah.
gonna
Yeah.
That would
take
be,
a little specialized search there, huh?
that'd be great.
And I've been I started playing racquetball back when I was just out of high school. So I actually used to play tournament racquetball for many years, and to the point where I stopped playing because no one could ever beat me. So uh
Oh, Brad. Yeah.
yeah, I never get out of the serving zone. And when I came back in 2005, I picked it up again, and the same situation happened. So you know, if I can find some racquetball players, those health first
Yeah.
places
Another
have
good
really good.
Another good selling point is over the counter too. Over the counter things. I found a lot of people are really interested in that because then they actually, you know, save money.
Yep.
You know, and from the premiums they're paying. So sometimes the over counter is good stuff to look at as well.
Yep. And we do have here at United Way a relationship with an organization that provides provides prescription discount cards too. If anybody needs any, we have a bunch here. So. All right, we have gone past the time allotted for this, but I appreciate all of your interest and activity on this call. And as soon as I have the opportunity, I will post it out on Facebook and see if we can get a little bit more mileage out of it. So thank you
Keith.
all.
Thank you too.
Thank you, Keith.
Appreciate your
Thanks,
time.
everyone.
You bet.
Thank you. Great
Bye,
session.
all.